One of the main problems hospitals face in Europe and around the world is the lack of respirators to take care of severe cases of COVID-19. Italy has surpassed China in the number of deaths, but I want to tell you about what can happen when imaginative people decide to help one another. Now, a hospital in Brescia, northern Italy, was running out of valves after treating patients of COVID-19, and the usual supplier, called Intersurgical, allegedly said that they could not make the valves in time to treat the patients. So two Italian engineers, Christian Fracassi and Alexandro Romaglio, who work for an Italian startup called Isinova, decided to 3D print the respirator parts for free.
I wanted to do this video to update you about the production of the 3D printed valves. So these one in particular are called Venturi valves. Inside of this tube, and sometimes even inside of that tube there, is pure oxygen that enters through the holes that you can see on the side.
Now, it was first reported that the manufacturing company Intersurgical had threatened to sue the two Italians because the valves were patent, but it later appeared that all they refused to give was the actual design files due to medical manufacturing regulations, which actually forced the two Italians to reverse engineer the parts. Now, the valves usually cost $11,000, but the Italian duo was able to make a replica for about $1. And after making that first project, they decided why not go further and make respirators altogether. And that's how they had the idea, with a doctor from the hospital in Brescia, to adapt a full-face snorkeling mask that's made by the French company Decathlon. And all they had to do was 3D print two other valves to be placed on the top of the mask for oxygen, but also for the reservoir. Now, the French company Decathlon has said that it has the mask in stock, and the hospital in Brescia has also said that it has ordered 500 of these masks, which are going to help save lives in Italy.